These are the current account fees to set up an account, and then per document verified. Now, we always say that it's nice to see all your documents, but we don't need to. It's very expensive for you to put in every single piece of paper, but your transcripts are very important. Your undergrad or your medical diploma is very important. Those pieces are huge, and we can work with you to help you fill these documents out. One of the fourth requirement would be the Medical Council of Canada evaluating exam. You have to, once you open up a physician's apply account, that will give you access to write the EE. So you must have written and you must have passed that exam. Now, the dates will vary every year, but these are the dates so far in 2015. And the nice thing about the Medical Council of Canada evaluating exam is that you don't have to be in Canada to write that exam. It can be written in 80 countries across Canada. It's a multiple choice exam, and it can be done anytime as long as you get in on one of these months to write it. Another piece would be to have completed the IELTS or the TOEFL. Now, in each of those bands, you'll have minimum requirements, and they're set out on our checklist. So as long as you've met those minimum requirements, that's important. Now, when you are applying, it's important to know that these come with an expiry date. So although for other things it might not matter, but for SIPPA and for the College of Physicians and Surgeons of Saskatchewan, there's a shelf life on these exams. So 2 years would be the minimum, and then you would have to rewrite. And finally, currency of practice. So you must have been current within the last 3 years in order to apply for this program. So if you're coming on 3 years and there's only just been a few days left where your currency is going to run out, if you're in the application process, we would encourage you to go back to where you have a license that you can practice and update that currency. Rule of thumb is for every year out, you would have 1 month back home doing that training. And we always say err on the side of caution. Do more than less, because it's very, very competitive to get into these programs now. And of course, you must be able to meet the immigration standards to work in Saskatchewan. Right now, we're finding out that many doctors are currently living in Canada, or they have immigration status in Canada. And so because of our legislation, we need to look at their files first and consider them before we would consider somebody else. So it's for an assessment program like this, it's a little bit challenging, but we also look at the file of a physician as well. If you're coming over CFPC and you don't need to go through an 18-week assessment, that's a bonus. However, we know that the supply of physicians in Canada that need this assessment will dry up, and so we want to make sure that we are working with you to make sure that everything is current on this checklist. So step 2, once we review that checklist, we will look at your CV as well, and we will make sure that everything is positive and we've got confirmation that everything can go through, and we send you forward to the College of Physicians and Surgeons of Saskatchewan. They will see that we've sent you an email as well as copied them in with your checklist and your CV, and they will ask you to fill out an eligibility review form. So once you submit that, they will send you an email saying that they are in receipt of your eligibility review, and they will confirm that you have paid the fee, and then they will start to review your documents, and they will inform you of the timelines that it will take to review. Now, currently they're at 17 weeks. There's such high volumes coming through Saskatchewan right now, with good reason. With the boom that we have, we do need a lot of physicians, and so there are a lot of applications coming through. What happens is they will look at everything, and then they will assess, and they will give you a letter of ruling. And that letter of ruling will either be a positive letter or a negative letter. If it's positive, then we work with you further to get you into the SIPPA program. If it's a negative letter, or it just might be further confirmation that they need something signed by your program director, or they need to clarify a few things. And if those things aren't met, then you will come back to our office, and we will have to tell you that unless you are able to provide those documents, the end of the line kind of starts there, unfortunately. So with that final ruling, you kind of come back to us. So we work with you all along to support you in getting the documents to CPSS to make sure that they know that you are proceeding with the documents, that you are waiting on certain documents. We work with the CPSS very, very closely. When you do get that final ruling though, that's when we start to match you to the employers in the province. I mentioned before that we have 12 different health regions in Saskatchewan. And as a liaison between all of us, we know where the vacancies are, and the regions will also reach out to SaskDocs and say, okay, we're looking for, we need 4 family physicians in this clinic, or we need some in rural, or we need some here or there, and it's up to us then to match the physician to the right opportunity. So it's a little bit of a two-way street. The physician interviews the region interviews the physician to make sure that that fit is there. There's no sense in us matching you to a very rural site when you don't want to be there, that you would rather be in a metro site, because you're not going to be happy, you're not going to stay, and it's not a good fit. And we're trying to fit for retention so that you want to stay in Saskatchewan. There is a 3-year return of service contract that is required when going through this route. So what to expect? Currently, it starts out with a 3-week centralized assessment. So we pay for you, the regions pay for you to come into Saskatchewan, and you start with a centralized assessment, and if you are successful, you move to a 12-week clinical field assessment. So we call it the CSA, or the CA, the centralized assessment. What that does is it provides you with an orientation to Saskatchewan, what to expect of working in Saskatchewan, health issues that you might only find here, opposed to what you might see back home. And they prepare you to write 3 exams that will take place during this centralized assessment. So there is a multiple choice exam. There are 150 questions in this exam, and they will cover a full range of the different disciplines that you will take in your postgrad training. There are short answer exams that are based from therapeutics, and this would be an example of a question that you might see on the exam. So we have our own set of OSCEs that you would do, and there are 12 stations, and in each station you get 10 minutes. If you are successful in all of those exams, you would move on to a clinical field assessment. So this is a 12-week assessment where you're out in the field working in a community, and you're working alongside other colleagues. So this is something that you probably don't see here every day, and that is a blue sky. So it doesn't matter if it is 40 below or 40 above, we have the most sunlight in in Canada. In fact, Estevan is a small community in Saskatchewan, and it has the most sunshine hours in the country. So we like to plug our Saskatchewan Medical Association. They're there to make sure that your contract is fair. They negotiate on your behalf. So any questions that you have about bursaries, anything that you have about wanting to come over,